plain CT scan abdomen of a 65 years old male patient. The patient presented with pain in right lower abdomen. There was local tenderness. On ultrasound examination, there was a cystic lesion in right iliac fossa. The patient was slightly tender to deep transducer pressure in this region. Now, this is a cystic lesion here. Superiorly, it is extending up to the cecum. Up to this level, it extends downwards, and medially, there is inflammatory straining of adjacent fat. Now I will show you his contrast and CT scan. This is the delayed phase. There is excretion of contrast medium in both the kidneys. Both the ureters are normal. The rest of the abdomen is normal. Now please observe this cystic lesion. There is marginal enhancement. Superiorly, it extends up to the cecum, up to this level. So this is fluid-filled distended appendix. Inflammatory changes are present in the adjacent fat. The density of fat along right supralateral border of the urinary bladder is also increased. There is thickening of peritoneum in right half of pelvis, suggestive of inflammation. So this is the infected mucocele of the appendix. Please observe this thickening here. It is not an appendicular abscess. In appendicular abscesses, we are all familiar with the appearances of appendicular abscesses. They are thick-walled. Surrounding soft hue density shadows are present. The increase in the density of the adjacent fat is much more, and the patient presents with symptoms of acute pain in right lower abdomen. While in this particular patient, the pain was not severe, and patient was slightly tender to the transducer pressure on ultrasound. But operatively, this was also found to be an infected mucocele of appendix. This is the coronal scan. Please observe this cystic dilatation of the appendix, surrounding inflammation, increased density of fat along the right supralateral border of the urinary bladder, and this extends up to the level of the cecum here. The features are very typical of an appendicular mucocele which has got secondarily infected. This is the sagittal scan.